Knock, knock. Come in. Provide patient privacy. Do hand hygiene. Hello, my name is Asha. I'll be your student nurse. I'll be your nurse for today. Can I have your name and date of birth, please?
Miss Bronchi, XXX.
Okay, Miss Bronchi. So I understand that you're having a misunderstanding of the medication Proventil. Is it okay if I further educate you on that medication?
Yes.
Okay, so your nursing diagnosis for this visit is deficient knowledge related to the Proventil medication, as evidenced by you stating that you only take the medication when you're shortness of breath and you just use the plastic tube. So I know you're experiencing shortness of breath and wheezing. So I'm gonna provide to you three simple short-term goals, okay? And these goals are you will state the use of the medication by the end of this teaching session. You will state the frequency and dose prescribed to you by the end of this medication. And you will state at least one side effect of the medication by the end of this session, okay?
Hi, yeah. Okay, bye.
Okay, so if you can actually silence your phone for this teaching session so that it doesn't disrupt the teaching lesson.
Okay.
Okay, great. So I want to further educate you on Proventil. So Proventil is the trade name for the medication, and then the generic name of the medication is albuterol, okay? So the way Proventil works is by bronchodilating. So it relaxes the lower respiratory muscles, lower respiratory tract muscles, okay, and it allows efficient airflow into the lungs, okay?
Okay.
So the therapeutic goal and outcome of this medication is to decrease your shortness of breath and your wheezing symptoms and increase airflow to the lungs, okay? All right, so I just want to list to you the side effects of this medication. So the side effect of this medication, you can experience palpitation, tachycardia, and you can experience dry mouth. When you experience tachycardia and palpitation frequently with the use of this medication, I would advise you to call your doctor or visit him and tell him that you're frequently having these symptoms, because they can further increase risk of adverse reactions, okay? And for dry mouth, I recommend when you take this medication, you rinse your mouth with water so that it can decrease the dryness of your mouth, okay? So the interaction with this medication, so it does interact with a few things. So the number one is beta blockers. So I don't recommend using any beta blocker medication because it does block the bronchodilation effect of this medication. I would avoid caffeine as well, because this could increase the side effects of palpitation and tachycardia. It can also have you feeling nervousness and increased tremors with it as well. And I wouldn't advise using MAOI medication 14 days prior to the use of the Proventil medication, okay?
Okay.
All right. So the frequency dose that was prescribed to you by the physician is 2 puff inhalers 4 times a day with aero chamber spacer, okay? So I saw that you have other inhaler medications, so I recommend that you first take Proventil, wait 5 minutes, take Cetrizine, wait 5 minutes, take flutecanose, wait 5 minutes, and take any other medications after that and wait 5 minutes to take it, okay?
Okay.
Okay, so can you explain to me the use of this medication?
It's a bronchodilator.
Okay. Can you explain to me one side effect of this medication?
Dry mouth.
Okay. And can you explain to me the frequency or dose that was prescribed to you by the physician?
2 puffs 4 times a day.
Okay, great. So I understand that also that you're going away, you're going out of town, which is nice. And you have a prescription of methylprednisolone acetate to be injected once for 7 days. And you wanted to learn how to inject yourself with that medication, okay? Is that okay if I teach you how to inject yourself?
Yes.
Okay, so I'm gonna go and get my supplies and I'll be right back, okay?
Okay.
Okay. Getting my supplies. Knock, knock.
Come in.
Okay. Provide patient privacy. Hand hygiene. Can I just have your name and date of birth again, please?
Yes. Miss Bronchi XXX.
Okay, Miss Bronchi. So methylprednisone was prescribed to you 40 milligrams per milliliter. Okay, just one time for 7 days. So I'm going to be teaching you how to inject this medication.
Okay.
Methylprednisone acetate is the generic name of the medication, but the trade name is actually Medrol. Okay.
Okay.
Okay. And so what this drug does is it decreases inflammation processes, and it decreases the inflammation of your lower respiratory tract since you're having trouble with shortness of breath and wheezing symptoms. Okay.
Okay.
Okay. So I'm going to show you. So the supplies you need gauze, you need your thigh, of course, you need the vial, you need the syringe. The syringe, it needs to be a gauge size of 21 to 23 since we're injecting it IM, okay? And you will need alcohol wipes, okay? So I'm going to put on my gloves. And by the way, when you're injecting this on your thigh, I want you to section your upper thigh into 3 sections.
Okay.
Okay. So the middle section is where you're going to be injecting, but the outer part. Okay. Right here. Okay. All right. So first, what I'm going to do is I'm going to take alcohol wipe. I'm going to clean the vial. Let it dry. Next, I'm going to clean the skin. Clean it and let it dry. Then, with the cap on in the needle, I'm going to draw up 1 milliliter of air. Okay? I'm going to take the cap off and make sure that the alcohol was dry. Insert it to the vial and insert the air in the vial. Now I'm going to eject the medication, 1 milliliter, since that is your dose.
Okay.
Take it out. Now what you want to do is you want to grab your skin. You're going to go into a 90-degree angle and you're going to go in a dart motion, okay?
Okay.
Inject it. Inject the medication. Now you're going to slowly take out the needle and also let go of the skin at the same time, okay?
Okay.
All right. So with the needle, you're going to use a swooping motion to recap it. And you're going to dispose of this into a non-puncture wastebasket.
Okay.
And you're going to tap and not rub if you have any bleeding, okay, from the injection site.
Okay.
Okay. Do you have any questions?
No.
Okay. So I would like to see you do it as well.
Okay.
If you don't mind. So
yes.
Here are your alcohol wipes.
Okay. So first, I will take this out and clean it. And clean my leg. Draw 1 milliliter of air. Take off the needle cap. Put it in the vial. Push the air in. And take out 1 milliliter. And take it out. Then squeeze the skin. And using a darting motion, go straight. And then as I take it out, I release the skin. Then use a swooping motion. Put it back on. And then I can dab.
Okay, and where would you dispose of the needle?
In the puncture basket.
Okay, great. So that is all for the self-injection teaching session. Do you have any other questions?
No.
Okay, would you like me to do anything else for you?
No.
Okay, all right. So I hope you have a nice day, okay?
Thank you.